from? Yeah. So this came from you and me having a conversation on the last retreat you were on at Taraloka, and you telling me a little bit about what you had done with your life, and particularly your work life, and me thinking, wow, that's really interesting, that's really inspiring, and definitely more people need to know about this and would be really interested if they did know about it. And like the area of work, I mean, it's just so big for people, isn't it? Do you want to just like tell us really briefly like what it is you've done with your whole work scenario, and just say a little bit about that, just to introduce it?
Okay. Well, we've set up on our own business, our own organisation. It is for people with brain injury, so people who've had an acquired brain injury in adulthood, so people like you and I leading normal lives and then had a massive aneurysm or road traffic accident or something like that. And that's the sphere of work we work in. We decided we wanted to set up some really excellent services for people to do the transitional rehab between hospital and going back home, so developing skills.
Is that your husband?
Yes, my husband and I. We've worked together previously and we're in the sector, but we just had an urge to, well, he did, and then he convinced me that we ought to set it up on our own, and yes, and to set things from scratch and to do it really well, some really therapeutic services for people to thrive in, both the staff and the service users. So that's kind of what we want to start off, and that was the turning point for me for doing it. I thought, well, actually we could do something really well where people would thrive, both sort of really high quality service but high quality atmosphere, really, and culture.
And I think I find that really interesting as well, because as you know, I was a physiotherapist before I moved to Taraloka, and what I really loved working in was neuro rehab. So for me it wasn't brain injuries, but it was like stroke, spinal injuries, things like that. And yeah, I think I just came to a real sense almost that what I was doing as a physiotherapist was more about like the quality of presence and interaction I could bring to the patient rather than what I was actually doing. Yeah, so then I was just very interested when you were telling me about your service that you'd set up. So Lucy, just tell me a bit about I suppose, when did you first come to Taraloka, or when did you first meet Triratna?
Okay, so a while back.
Yeah.
I started practicing, I met the Dharma January 97.
Wow.
Yes, so I was at university and I accidentally went to a talk on Buddhism in the 20th century, I suppose.
It was accidental, was it?
It was. So, well, I was just interested in things, and I didn't realise there was going to be a meditation in it, otherwise I wouldn't have gone. And I concentrated so hard on not being brainwashed that I actually got into some state of absorption. I thought, this might be something in this, you know. And I went along, and really I was struck, partly with that meditation was a really practical way to actually change your mind and work on yourself and develop yourself. I was really struck by that. And then the ethics, there's a series of talks on ethics, which I did go to less accidentally. And it just rang true. Most about people say it was the truth, and that's never really wavered from that time. So. And then I started coming down to Taraloka quite regularly since that point. So and through the years, and it's been a very important part of my practice to be here. Such a beautiful place and magical place where people transform, and to have that sort of depth of practice which is built up through time. So I'm very grateful for this space and all that you do here.
Well, it's lovely having you come, and you've been practicing longer than I have, quite a long time longer. Okay, so let's see where I have to think slightly. What am I going to ask you next?
About the first retreat?
Yeah.
Is that helpful? Moving on from that.
Yeah, totally. Yeah, tell me a bit more about that retreat.
So there was one pivotal retreat which I came on here. Well, there's a lot really, but in relation to this context of setting up the kindness culture. And it's quite a while ago. So it's at a time when it was Diane Andy, Kalyana Prabha, Maitrisiddhi, they were running those meditation retreats in the late 90s, and I used to come down, and I was just really struck on this one retreat. It wasn't particularly on kindness, as I remember, the theme of the retreat, but that during this retreat, people were becoming increasingly kind. So there was this momentum. It's almost like people had the permission to be kind, and then they sort of opened up like these flowers, sort of being more and more increasingly kind to each other. And I have this memory of sweeping the floor and then somebody else just coming naturally along with a dustpan and brush to do the bit, which does happen on retreat, but it was just really tangible, it was contagious kindness. And it really struck me where I thought, if you've got 30 people here, 30 plus people, complete strangers, and they're becoming increasingly kind, and that's happening over in this 10-day period, then logically it's possible for that to happen in a workplace of 30 plus people. If you can do it there, you can do it somewhere else. So that was kind of quite pivotal for me in terms of thinking about the possibility of having a compassion-based, kindness-based culture in the workplace. And because I'd seen it, and I think that's interesting, isn't it? I'd seen that it was possible here.
Yeah.
And that was what sort of kickstart when we set up our own organisation. That I thought, actually, it's possible. And in health and social care, it's quite, as you'll know, it can be quite pressurised. It's very people-based, so there's a lot of people and a lot of interaction and partnership working. And people are doing very good work and trying their hardest, but there can be some sort of pockets of negativity, and social care, some care services actually don't feel very caring sometimes, or there's a kind of background culture of sort of backbiting and those kind of things. And I thought, no, it doesn't have to be like that. There's a sort of view in work in some quarters that it's inevitable that it's going to be a bit miserable and hard or toxic, and I don't believe that. Because I saw here that it didn't have to be like that. So actually, I'm not saying things are likely to be perfect, set of human beings, but actually it certainly doesn't have to be negative and toxic. So that's sort of what started off in my mind, setting up an organisation on that basis. And these days, actually, there's a lot more research-based, positive psychology research-based, coming out of the late 90s, but certainly in the last few years, a lot more research on kindness and the impact of kindness in the workplace. And the evidence base says that it makes people happier, work retention's better, that there's obviously less conflict, people are more productive, actually it's more better financial performance, people live longer. It's sort of endless benefits of kindness, apart from it's just nice. So these days there's a lot more evidence on those things, so it would be in some ways easier to set it up now, because you'd be quite easily go to your bosses or to someone and say, actually there's this evidence base, we should do it for these very good reasons. But when we set up we started off properly in 2015, so 10 years ago, it felt like it was quite a twee concept to say that I want to develop a workplace on kindness.
I kind of imagine what it would be like, because I was working in the NHS back in the kind of, I don't know, 2005, 2006, those sort of times, and cool. I could just imagine me going to my boss and saying, right, so I think we should base this service on kindness. Like, what would they, I think they would have sort of walked away kind of thinking, what's she on?
Yes, exactly. A bit woo-woo, a bit like you've lost it.
Yeah.
And I think particularly in health and social care, there's a very medical model.
Yes.
So everything has to be quite scientific based and evidence based, otherwise you really shouldn't be doing it. You're going a bit off piece somehow.
Yeah. And also it's really focused on fixing the patient. And the professional puts on a uniform and then they're professional, but it's like there's nothing that looks at how the professional can be supported, or like a culture that can allow the professional to be more human in their work. And I bet all this new research that has been going on has been kind of bringing that out.
And it's supportive for the staff, but actually then you can meet the person that you're working with on a much more human basis.
Yes.
I often describe our style of rehab as human rehab. So it's kind of, it's not so clear, it's that there's a human being here having a horrendous time, and we meet them as another human being, understanding what suffering's like, maybe not understanding this, but we can hold that on a basic human level. And often when I've got my new starters and they're worried about they might not be able to say the right thing, or they don't know enough brain injury jargon or kind of what to say, and I was just saying, you need to care, you just need to be there, and you can even say, I don't know whether I have the answers, but I can see you're struggling, and if there's anything I can do. And that in its own right, just being properly present with people, is a bit like you were saying at the beginning, it's healing in its own right, isn't it?
That was so what I came to towards the end of my time working as a physiotherapist in hospitals, where I really felt like the quality, the amount of presence that I was able to bring to this person in quite an extreme state of shock and suffering, that was the biggest effect of anything that was happening, like how much presence I could actually bring. Okay, so in a bit I'd like to go into kind of like how you created that, but I'd like to take you back a bit now to so just talk about, so you met the Dharma quite early, you were 20, you were still at university. So tell us a bit about, like, what were your life choices, or what were you kind of, what was your, what happened?
What did you hear? Yeah, so I was doing a fine art degree, so this doesn't
totally relevant to health and social care.
No, although I would say, I think, I do think it's a creative process. And I think there's something about being able to be visionary in something, and the artistic process is rehab. So from rehab point of view, I go and assess somebody in the hospital and their broken shell of who they've lost sense of who they are, they've lost a lot of functioning, and they're a very battered person, and I can see what I call their flourish potential, their potential to be what they really can be, and what they can still bring and be better with the right support and the right circumstances. So you see that, and they can't see that themselves. And I think the artistic process is having a vision for something beautiful and beyond. A bit like practice, isn't it? We have this vision that we could be, the Buddhas give us, don't they, that we could something much deeper than what we're currently in.
And it's interesting, isn't it? Because in a way, without that sense of potential, which either you have to hold for yourself or someone else has to hold for you, actually that potential could be there, but that person is never going to step into it. So when you go to see that brain injured person in hospital, you're seeing their potential and giving them a space where they can step into that potential.
Absolutely. And that's a precious gift, I think, seeing that in anyone, whether you're seeing it in patient or when other people who are practicing. I mean, certainly for me in my practice, when people have actually seen through my mess, they've actually seen that I've got the potential to do so. It's so powerful because they can tap into that potential within you, and then you can almost see it for yourself, or even they can see it, so that could move on. So I think there is this. It's an interesting process, but
so there is a relationship between art
and
creativity.
I think so, and yes, and beauty.
Social care.
But going back to my degree, sorry, that's a deviation. So I was doing a degree in fine arts, and in some ways meeting the Dharma when you're 20 is an amazing thing, and I'm very grateful for that in some ways, but in other ways it's quite disruptive. It sort of seems the opposite of what everybody else is doing at university. And then I went on pilgrimage in my degree for about 9 or 10 weeks, and then there's some holidays, and that was quite significant. And there,
So you were where?
India and Nepal, sorry. And during that time, I did make a commitment that I would lead my life in the benefit of other people. So that was quite a strong moment. And I come back to the UK, I get back on with my degree, and there was another moment where within the sculpture studios, you're sort of left, it's a bit feral in a fine art degree, you're kind of left doing your own work. And then periodically the tutors would come in and chunter about things and then wander off again. And I have this particular memory of one of the tutors coming in with a cigarette in one hand, discussing my work, which was on the wall, in juxtaposition to the plug socket. And I was a bit like, I've just spent weeks doing this and you're talking about the plug socket. And I was a little bit like, what am I doing? There are people suffering out there. And you're talking about the plug socket. So I was just like, actually, that was sort of the next note, which was like, I don't think I'm going to be doing this really as my career. I can't. Not that it doesn't have its place, art, and it is transformative for people, but for me at that point, it's like I really need to be doing something which is more hands-on and more directly helping people. My plan was to graduate and go and do art therapy degree, but I didn't have enough money to do that. And I also thought I better go and work with some people in social care, because I might not actually like working with people, because I've been in a white studio with loads of art students for a long time.
And it would be a good idea to find that out.
I thought so. I'm sort of doing a bit of a practical experiment. But I worked as a care assistant in a nursing home for about 9 months, and I found I loved it. It's very simple, but it's so undervalued, health and social care.
So true.
And it's so transformative and amazing. So if anyone, even if it's a shift a week, go and do it. Because it's such a practice, and it really shifted my practice to being kind of out there, really, I suppose. So you very much like Shantideva, transference of self and other. So there's this person, this being who's part of me, which needs cleaning up and sorting out and holding in that kindness. So it's very, very moving, practical work, and elderly care, obviously working with people in palliative care and people dying and those kind of things. So it's very sort of work which turns you inside out. You have to, it's sort of, it's the way I would describe it. You have to sort of surrender to it, and it's very much all-consuming in that sense. And then I moved to Birmingham to be more close with Sangha in Birmingham, because I had some connections down there, and I started working in services with people who had a mixture of mental health and brain injury. They put me in a challenging behaviour unit to start, because they thought as a Buddhist they thought I'd be calm.
And were you calm as a Buddhist?
I don't think I've ever been particularly calm. Still not very calm. So it's an interesting thing, isn't it? So
possibly calm isn't the only quality Buddhists manifest.
No, I did say it's Buddhist, not Buddha. You know, I think there was kind of a misunderstanding there. Exactly. Yeah.
Probably. Were you still being a care assistant, or what was your role?
My role was support worker, and then I moved up into social care management. I began to develop a passion for working with people with brain injury. I just felt like there was sort of at the time getting slightly shelved in long-term services, and I was like, these people, I guess I got a real belief that people can develop and need as human quality to be able to develop and need to develop. And then there were these people in these services where they were just doing good quality of life, but actually how do we set them forward? And that's where I got more interested in rehabilitation and working with people. So I worked up to being social care manager, and then it's sort of, that's where my career went, and then worked in different organisations developing brain injury services more nationally.
And what was the point? So you told us about this very pivotal retreat where you saw 30 people on retreat just becoming more and more kind, and thought, hey, this could happen in a secular context. Did you try making that happen just within a service you were working in, rather than one you'd set up?
Not so explicitly like that, although in the services that I was managing, obviously beginning to build some of those things up. And I'd done my postgraduate degree in brain injury rehab, and my dissertation was on the impact of altruism on people who've got severe brain injury. So I was interested in actually the act of giving, acts of kindness, even with people with profound disabilities, the impact that it would have. And from a result of doing that, it's really interesting, because it's things like people were doing, they could do acts of kindness of whatever they wanted to do, because I didn't think you can dictate what they want to do. And you get these the reports.
It wouldn't exactly be kindness.
No, not really. You have to be smiley at people to work, does it? But they came back with the reports and through the study of things like, I offered Tim a polo, or I opened a door for somebody, I helped load a table. They're just beautiful, just small things. And from that, there were things which came out of it, which the services where they was doing the research in, they started doing certain strategies. So they started having like a positive things notice board, and putting on all the positive things, like off the polo and these things, and the snowballing was beginning to happen in some of those services. So I didn't set it up in that way where it is absolutely underpinning in the whole organisation, because I only had my service that I was working in, but we had our core value base which we were working on, and I realised that you had to have that core vision as a manager and be very clear on what you're wanting to achieve, so that people can come on board with it. It has to be explicit. But it was just, so it was done, but when we set up Ariya on our own, then it was just fundamental and underpinning, non-negotiable.
Great. So tell me a bit about that decision. So like what meant that you, in fact, we should just say that your service is called Ariya. So do you want to say a bit about its full name and why you called it that?
Okay, so it's Ariya Neurocare, and it often gets shortened to just Ariya. So, well, partly we couldn't find a decent English word was part of, so it did wind up with Ariya, but there's a very good reason why, which I don't normally talk about.
It's okay, this isn't helpful.
Yes, so normally I'm spending my time kind of having an inner spiritual experience, which I'm translating into more of a secular experience. This has been my experience talking about work the last 10 years. And this is like the polar opposite. This is actually talking about the secular work and explaining the inner workings. But I had a meditation, and within this meditation we were thinking about setting up Ariya, or what would be called Ariya. And I had this very strong vision of Avalokitesvara appearing to me in this meditation, and just this sort of vision of almost his power just driving through, and that compassion just driving through the project, and driving through, and it went beyond. It wasn't even just stopped at that, you just have to do this. It's just like, this is what you have to be getting on with. Almost let his will kind of come into the world, really, let that compassion seep into the world somehow. And so from that point, it's like, this is just what we've got to do, which is great, because it's quite scary setting up your whole business. But that's why fundamentally I always knew it would work if it was done with good intention, because we had this backing, almost like, in some respects, in many ways, like it wasn't us. We were just the facilitators to sort of do the focus, and we did have to do some work for it to happen, but the sort of background light really was was coming through, and in some ways we sort of would get out of the way to let it happen. So we called Ariya because of Ariya Avalokitesvara, which I'm not sure people at work know.
What do you tell them about Ariya? Because obviously that's noble, isn't it?
Yeah. I say it's because it's noble and sort of strength through ethics. So having the importance, and that we talk about that. So is the reasons why. I do a day's values training for every new inductee. coming into the surface the whole day, talking about the values and importance, how we can uphold them, why it's fundamental to creating for people in their rehab and for each other. It's a precious thing. And within that, I talk about why we call it Ariya, and that sort of it's that integrity and doing things well by people, and then it gives you that strength and that confidence, and actually it's unshakable in that sense. When you've got that quality really, and that value base is really strong.
God, you're just making me want to cry, Lucy.